You hear it all the time about harm reduction, safe injection sites. These are the things that we as a caring society apparently are supposed to embrace. But what comes with those very entities are crime, increased crime, and in one Leslieville community, a murder. Hello, I'm Adrienne Batra. With me are Warren Kinsella and Brian Lilley. Brian, there are some fill in the blanks for our viewers on the latest that has happened on the Leslieville shooting near the healthcare community center.
So this shooting happened adjacent to, right next to, and across the street from the South Riverdale Community Health Center. This is a facility in Toronto that is licensed by the federal government. It's administered by the Toronto Public Health to a degree. It's funded by the province, which also has some regulations. So every level of government is involved. None of them want to take any responsibility. But on July 7th, a woman was shot and killed just walking to go get lunch after three men in a park next to the safe injection site facility got into a fight. Two men have been arrested so far, but this week also a woman named Khalila Muhammad, who worked at the center in the safe injection site, profiled by CBC as a spokesperson and someone doing the great work at helping people who are addicted to drugs. She's charged with accessory after the fact, allegedly helping one or more of the shooters escape, and obstruction of justice because she wasn't cooperative with the police in their investigation. The allegation is she didn't run to help the woman who got shot across the street, Karolina Huebner-Makurat. No, she helped the people who police say carried out the shooting. That is unacceptable. The center says they didn't know. They're feeling horrible. But this is a center with a lot of problems going on. And in my view, they've either got to be shut down or the Ford government has to step in, fire the senior management and fire the board and put adults in charge.
Warren, I don't think it's too harsh to suggest that this one in particular obviously needs to be revisited and potentially shut down. But these are sprouting up all across the country, and we're not seeing a reduction in usage by any means. We're not seeing a sort of shift in society or any of those things. So we can look to other jurisdictions, like British Columbia, for example, and I know you've got some numbers there, that things are going to be sprouting up even more across communities everywhere. And we have no ability for harm reduction. We have no ability for those quote unquote wraparound services. We have nowhere to house them. What's the solution here?
Well, it's not what Toronto Public Health wants. Toronto Public Health has called for the decriminalization of personal use of all drugs. So, as you mentioned, that's what's happened in British Columbia, where I used to live. Here's what's happened in British Columbia. Overdose have increased by 600%. Just yesterday, we find out that now the leading cause of death for youth from the age of 18 down to the age of 10 is drug overdoses. The majority of them are males. The vast majority of them are being killed by fentanyl, and they're being killed while they're at home. So when there has been this decriminalization of these types of drugs, addiction has exploded. That's been the experience in Europe and the United States and elsewhere where they've attempted this dangerous strategy. So, the solution here, I think the people in Leslieville would say, shut this thing down. Don't make it easier for people to get drugs and to become addicted to these drugs, because we will have more death. So, to me, this isn't a debate anymore now that we hear about this arrest of somebody actually working there, allegedly helping the bad guy get away. Shut it down. It's now time. It's over. They had their chance. They blew it. Shut it down.
Brian, last word to you. You certainly have been in the area talking to the residents of the community, but this isn't just one community that this is has affected or will affect. What are they saying?
There's a lot of people who were open to the idea when it started and who still believe that these addicts need help, but the center's not doing a good job. They're not looking at anything beyond their four walls. And so, the supporters of this center continue to say that July 7th shooting of Karolina had nothing to do with the center, even now that we have somebody who was has been arrested and charged in connection with the shooting. That doesn't hold anymore. Nobody can believe that with any credibility. But, you know, to go back to Warren's point about the increasing overdoses, British Columbia is at more than 3 times our overdose rate here in Ontario, or about 3 times. We don't want to go down their path. We don't want to become Vancouver's downtown east side. And yet that's what our public health officials want. The idea of harm reduction was sold to us, Adrienne, as, well, bring in this program. It'll help save lives and it'll help get people into treatment. That's not the case, because they're no longer pushing treatment. Here's the philosophy of the South Riverdale Community Health Center. You will find it replicated by people across the country on this. Their philosophy is no judgment, no expectations, and no desire for people to stop using drugs. That's right on their website. It's been on their social media accounts. It's been on their posters. They don't expect you to stop using drugs. They put out their annual report. They're boasting about how many people they helped inject or snort drugs. You know what they're not boasting about? How many people they got into a treatment program, because that's not what they push. They push continuing to use drugs because drugs are great. Drugs are fun. No, this is not a compassionate society. We were sold a pig in a poke. We're not getting what we were told. I agree with Warren. Shut it down, and at the very least, put in adults in charge. Stop the safe supply claptrap, and let's look to help people who are addicts, not aid and abet them in their addiction.
Well, let us know what you think in the comments below, and go to theTorontoSun.com. You will find stories and coverage there on this and others you will not find anywhere else.